So hello everybody and welcome back to my YouTube channel, and today we will be discussing about some memory based questions and some most frequently asked questions in pharmacy competitive examinations. So myself Payambora, and here you can see my ranks in certain all the 8 competitive examinations. So firstly, the first question is, ophthalmic solutions are not evaluated for. So we all know that ophthalmic solutions and parenterals needs to be sterile. So we will eliminate this option. Active ingredient, of course, if we do not know the amount of, suppose if it's a glaucoma drug, suppose if it's timolol eye drops. So the amount of API is necessary. So will we evaluate? Of course we will. So let's eliminate this as well. Clarity. Of course, if the eye drops are opaque, if they are not clear, if there are particulate matters, it is going to irritate your eye cavity, your cul-de-sac. So let's eliminate this. Pyrogen test. This is test that is specific for parenterals, that is actually entering into your bloodstream directly. So the answer will be pyrogen test. The next one we have, isoniazid causes hepatotoxicity due to. So the 4 options are due to its metabolite acetylhydrazine, due to accumulation of isoniazid in hepatic cells, due to its metabolite acetylisoniazid, and due to deficiency of pyridoxine caused by prolonged isoniazid therapy. So we all know that prolonged isoniazid therapy leads to reduction in the vitamin B6. So that is why we give vitamin B6 along with isoniazid. But the main actual cause of this hepatotoxicity is your acetylhydrazine. So your acetylhydrazine will be the correct answer. Next up we have azaspirodecane azaspirodecane. These are agents that are primarily used in the treatment of. So in the classification of anxiolytic, you would have seen a drug buspirone, which is a partial agonist at serotonin receptor. Buspirone, which is a partial agonist at serotonin receptor. So it belongs to this category, azaspirodecane. So it is an anxiolytic drug. OCD, obsessive compulsive disorders, no, they do not contain this nucleus. Mania, you usually have lithium carbonate in mania. Schizophrenia, you again have certain drugs that deals with the dopamine reduction and so on and so forth. So the answer will be anxiety. Next up we have paracetamol is a derivative of. Such an easy question, and such an easy question to answer. Antranilic acid, we all know that mefenamic acid belongs to the class of antranilic acid. Aryl propionic acid, ibuprofen, ketoprofen, florbiprofen, all the profens. Aryl acetic acid. Aryl acetic acid is also very important category of your NSAIDs drugs. And next we have para-aminophenol. So para-aminophenol is the main answer because that is what is paracetamol containing. At para position you have an amino group, NHCOCH3, and then you have an hydroxyl group. So that is what the derivative is. Para-aminophenol is the right answer. Next up, the phosphate containing antiviral agent. So in antiviral agent, we all would have heard about the triazole ring containing drug ribavirin, diadenosine, which is an adenosine analog, ganciclovir, again a drug in herpes, and foscarnet, which is the only drug that consists of a phosphate group. So the right answer will be foscarnet. Next up, the film former in nail lacquers. In nail lacquers, you usually have nitrates that acts as the lacquer formation, the film formation. Ethyl cellulose is a polymer, so it is usually used in controlled sustained release. And so acetate, yes, it is used, but nitrates at a greater extent would be the right answer. Next up, which of the following metabolite of cyclophosphamide is responsible for its toxicity? So if they would have asked which is responsible for its potency, it could be phosphoramide because it is a nitrogen mustard, right? Or aldophosphamide, which is the active metabolite, 4-hydroxyphosphamide, which is similar to aldophosphamide. But they have asked about toxicity. So mesna is an antidote. Mesna is an antidote for this toxic metabolite. N-mercaptoethane sulfonic acid. So the right answer will be acrolein, which is also formed in the synthesis, which is also formed in the scrop synthesis for quinoline. So this is how you link your medicinal chemistry, your organic chemistry, and your pharmacology together. It is also used in the scrop synthesis in the formation of quinoline. So the right answer is acrolein, which is a toxic metabolite of cyclophosphamide. Now if we speak about the food poisoning is widely caused due to Clostridium botulinum. Clostridium botulinum is a main metabolite that causes food poisoning, and botulism is itself, the synonym of botulism is food poisoning. So the right answer is Clostridium botulinum. And tetani is causing tetanus. Tetani causes tetanus. Clostridium tetani causes tetanus. We take the injection of tetanus, right? Next up, we have nitric oxide synthetase is responsible for the generation of nitric oxide, which is an important signaling molecule. So this nitric oxide is involved in vasodilation and all. You would have heard about the CGMP pathway and CAMP pathway. So nitric oxide synthesis is responsible for the substrate. What is the substrate? Which amino acid? It is arginine. Arginine is a very strong amino acid for nitric oxide. Histidine is an amino acid for imidazole. It is a imidazole ring containing amino acid, and glycine is responsible for hemoglobin. So that is why this is understanding these amino acids, that which are the substrates, is very important. So the right answer is arginine. Next up, we have chloramphenicol and tetracycline. These are all you would have heard about buy at 30 and sell at 50. So aminoglycosides and tetracycline, they both act at 30s and inhibit protein synthesis, while your macrolides and chloramphenicol, they act at 50s. So and inhibit the protein synthesis. This has been a gate question a many times. Some or the other way this question has turned up. So see to it that you study this question appropriately. DNA synthesis, now we have certain drugs like dihydrofolate reductase, DHFR inhibitors like sulfonamides, trimethoprim and all. So those act at DNA. RNA, we have DNA dependent RNA polymerase. Rifampicin inhibits this enzyme. So again, it couldn't be the answer. Cell wall, we have all the beta-lactam antibiotics like penicillins, cephalosporins, monobactams, carbapenems, vancomycin. These are few of the agents, bacitrexin, that can act on your cell wall. PCMBV. So here you have the right answer as protein synthesis. Next up, we have Dick test. So diagnostic tests are quite oftenly asked. So Dick test is specific for scarlet fever, and Schick test is specific for diphtheria. Schick test is specific for diphtheria, and Dick test is specific for scarlet fever. Tuberculosis, the right answer is Vidal. The right answer, the right answer is Mantox, which is also called as tuberculin skin test, and in typhoid we have Vidal test. So this is how it works. This is how the appropriately you need to remember the diagnostic test and the disease. So the right answer for this is scarlet fever. Now here it is a match the column. So here if you know any one also, no, you can eliminate few options. Like here if we know the most abundant antibiotic is IgG, so we know that 2 ka it is going to be R. So 2 ka R isme hai. So these are firstly eliminated, and now these both have 2 ka R. Now we'll see IgE. IgE is usually involved in parasitic infections. So if 4 ka Q, there you have, the option is left is this one. So the right answer is option C, that is IgA is usually your mucosal immunity. Your IgG is the most abundant antibody in the blood. Your IgD is found on the beta cell membrane, and your IgE is involved in immunity to parasitic infections. Next up, we have which one of the following parasites does not cause lymphatic filariasis? Does not, except, these are few words that we cannot miss upon at all. We need to remember these words very well. So Bruguier malayi, Bruguier timori and Wucheria bancrofti, all of them cause lymphatic filariasis, which is also known as elephantiasis, hathi ka pair. We usually because there is edema and there's a lot of fluid retention in this condition. So the right answer is Manzanella streptocarica, because this is not involved in lymphatic filariasis. Now again a match the column. Here if you know few things, then it becomes simpler. You know Fick's law is in diffusion. So RK4, which are the options having, so this is eliminated. Now next, you know Bond's law is for size reduction. So SK1, now this is also eliminated. So it can be either A or B. Now next thing, Newton's law, it is related to cooling. So pK2, yeah, there you go. So you eliminate all the three options, and Hertz constant is responsible for damage to fruits and vegetables, because it is usually leading with ethylene, abscisic acid and all. hormonal changes. So that is what now your answer is your A. A is the right answer. Sterilization of milk and dairy products. Very important question from microbiology part. Sterilization. So sterilization is usually pasteurization. Do we perform gaseous? No. Gaseous we use formaldehyde, paraldehyde. We use glutaraldehyde, beta propiolactone. Moist heat may be use autoclave. Dry heat may be use hot air oven. But pasteurization is a technique. We have two types of pasteurization: low temperature long term and high temperature short term. This method is called as flash method, and this method is called as Holder method. In flash method, you have 72 degrees Celsius for 15 seconds, while in Holder method, you have 62.8 or 63 degrees Celsius for 30 minutes. So this is what is the difference between the two types of pasteurization. So the right answer here is pasteurization. Next up, we have which one of the following is the initial step in the absorption of drug from a tablet. So suppose this is a tablet. The tablet will first disintegrate, then it will deaggregate, then it will finally dissolve in the medium, in the dissolution medium, and finally it will diffuse through the membrane. So the disintegration is the right answer here. Bond taggers test is used for the identification of. Bond taggers test is usually, there are two types of tests. One is for C glycoside and one is for for O glycoside. So your aloe, cascara, all of these are C glycosides, and for them we use modified bond taggers. But for O glycoside like senna, rhubarb, we use only bond taggers test. So here the answer will be senna. Next up, an enzyme that is catalyzing the conversion of aldose to ketose. So aldose sugar to ketose sugar. So here it is isomerization reaction. Oxidoreductase, is there reduction and oxidation taking simultaneously? No. Is there hydrolysis? Is water molecule involved? No. Is there any transfer of amino group or hydroxyl group? No. So it has to be isomerase enzyme. Hyperuricemia is associated with. So hyperuricemia is a gout. It is like due to accumulation of uric acid, and allopurinol is a widely used drug. So here it is due to purine metabolism, due to abnormal metabolism of purine. Riboflavin is vitamin B2, thiamine is your vitamin B1, and nicotinamide is your vitamin B3. Crystalluria, most commonly known crystalluria. Fluoroquinolone causes phototoxicity. That is very evident. Sulfonamides causes Steven-Johnson syndrome. They causes kernicterus. They causes crystalluria and so many other side effects. So the answer has to be sulfonamides here. The complete separation of two phases. Creaming is what? Reversible. If there is a creamy layer deposited at the top. Leaching, is it a parental solution? Is there leaching involved? No. Sedimentation? No. Is it a suspension? Nah, it's an emulsion. So it has to be cracking here. There is two completely दो अलग phase separate हो गए. Next up, a preparation containing a killed or attenuated vaccine is termed as. So here the answer is vaccine, because your toxoids, your diphtheria toxoid, your tetanus, these are obtained from horse serum. Antiserum to couldn't be an answer because it is not containing killed or attenuated virus. So how can we even consider toxins? No. Do we administer toxins? We administer botulinum toxin, of course, but it is a Botox. We call it Botox injections, but that is a separate thing. Toxoids? Nah. So the answer has to be vaccines. Next up, which one of the following is an anti-filarial drug? Anti-filariasis. So filariasis is a very important disease, and we only have right now one common drug, which is diethyl carbamazine, DEC. So here they haven't given the direct drug's name. Here they have given the official acronyms that they are represented by. So if you know the drug, but if you don't know the short form, what's the use, man? So INH is isoniazid, which is the anti-TB. PAS is para-amino-salicylic acid, which is again an anti-tubercular. DDS is anti-leprotic, diphenyl diaminosulfone, which is a dapsone. So it is also anti-leprotic, and DEC is diethyl carbamazine. So the right answer is DEC. Kala azar is a type of Kala azar, very widely known, and sodium stilbogluconate. Sodium stilbogluconate is widely used along with liposomal amphotericin B in this condition. So we have the right answer as leishmaniasis, which is also called as visceral leishmaniasis. Emetine is the main ingredient of pyrethrum. Pyrethrum is a mosquito repellent and pyrethrin is the active constituent. Rhubarb, nah, it cannot be the right answer. It's a glycoside. Isapgol, it is a bulk laxative, so it has to be Ipecac. Syphilis ipecac is a main source for emetine. So the right answer is emetine, Ipecac. Salbutamol. Do we remember? Do we remember the category of salbutamol? Is it a beta 2 agonist? Yeah, it is. Yes, it is. Is it a short acting or a long acting? It is a short acting beta 2 agonist. Long acting we have salmeterol, formoterol, etc. So the right answer here is it a mast cell stabilizer? No, mast cell stabilizer. I hope we all are aware. What are the mast cell stabilizers? Sodium chromoglycate, nedochromil, ketotifen. I hope we are aware about these terminologies. Antitussives, no, no chance. Immunosuppressants, no. Is there tacrolimus, cyclosporin, sirolimus involved? Nah. So it has to be bronchodilator. It is used as an anti-asthmatic drug. Chlorpromazine, antipsychotic, medicinal chemistry. Obviously, there is a phenothiazine ring. There is a phenothiazine ring. This is what is a phenothiazine ring looks like. So chlorpromazine has a phenothiazine ring. It has a 3-carbon length chain as well. So the right answer is phenothiazine. Acridine is present in tacrine, which is a anticholinesterase. Fluorobutylophenorones, we have haloperidol, droperidol, resperidol, haloperidol, droperidol. Thioxanthine and chlorprothiazine, thiothixine and all. So here the right answer will be your phenothiazines. The diagnostic agent used for thyroid glands. So thyroid glands may be widely used iodine 131, which is a radioisotope. It is widely used for the diagnostic function. Next up, we have Drug and Magic Remedies Act was passed in. So in 45, Drug and Cosmetic Act, do we remember? Or was passed in 1940 and the rules were passed in 1945. In 1960, we have Prevention to the Cruelty of Animals Act. 1955, we have Medical and Toilet Preparation Act. And 1954 we have Drug and Magic Remedies Act. So the right answer will be your 1954. Now here, did you see one thing? Did you notice? With one question I have solved 4 other questions and 4 other concepts. So when you're solving an MCQ, see to it that why others are not the right answer. Why only 1954 is the right answer. Please have that practice. Next up, the schedule where list of drugs are to be sold on prescription. So in Schedule G, we have those drugs that are to be sold under medical supervision. Schedule X, we have narcotics. Schedule M, we have good manufacturing practices. Schedule W is for patent proprietary non-generic things. V and W are correlated. And H is the one where list of drugs are to be sold under prescription only. So the right answer is your H. The next category is the anti-arrhythmic drug that is used to control seizures. So we have a local anesthetics that can be used as antiarrhythmic, which is a lidocaine. But here what have they asked? An antiarrhythmic which is used in anti-epilepsy. So we know that epilepsy may be only have one drug, which is phenytoin. And phenytoin belongs to which category? Lidocaine, lignocaine, xylocaine, mexiletine, phenytoin, class 1B. Is it? I hope we all can recollect the class Vaughan-Williams classification of antiarrhythmic. That's very important from GPAT point of view. So the right answer is phenytoin. The cellular organism called as suicidal bags. This we have been learning since childhood. Okay, cellular structure. So we all are aware that Golgi bodies are protein factories. Your ribosomes are actually your ribosomes are proteins. We have smooth endoplasmic reticulum and rough endoplasmic reticulum, SCR and RER. Your lysosomes are your suicidal bags, and the powerhouse is your mitochondria. So the right answer is lysosomes. The drug used in the dope test for athletes. So dope test is usually a test where we use amphetamine. Because it is very important. It is certain athletes take certain hormones or certain drugs so that their energy, so that their stamina is enhanced. And amphetamine is a drug that is used for the dope test. So that's all for today's video. I hope you all did enjoy and learn a lot. So on your demand, I have brought about few frequently asked questions and few Q&As that are memory based questions of certain examinations like IIT, CUET, Manipal, BITS, etc. I hope you all did enjoy. If you have any doubts or you want to reach out to me, you can contact me through any of these credentials. Thank you so much, everybody.